interaction with a guy on a training platform that I help with, and you do some coaching and reviewing and question answering through there. And this gentleman, I may have mentioned before on another video, but I just want to talk about it again because this comes up a lot after back surgeries, especially major back surgeries. Patients who went through them, they leave the situation with the impression that they can't do anything ever again, pretty much, to put it in a nutshell. But even in real complex surgeries like this gentleman has had, you can get back to training once everything is healed. The hard, if they have to use hardware, anything that they implant to the body is going to be permanently fixed sometime within that first year or so. And if you look at restrictions on training and lifting after back surgeries, even fusion procedures, there's no real contraindication to training. A lot of surgeons will implore you to avoid high contact sport after these kinds of things. But even nowadays, there's been guys return to playing NFL level football after fusion. So that might even be running its course as well as they advance whatever technologies and things that they use. But the big one is lifting in particular. And we have this gentleman in our group that I work with on the side who has had, if I can't remember exactly, but 15 or 16 level spinal fusion with rods implanted. And he continues to deadlift without incident, 100% safely, continues to back squat, put a bar on his back and squat 100% without issue and safely. We give him feedback on his training and his lifts and try to help him along. But the important thing to know here is, what was this guy going to do? You have all these hardware implanted in his spine and then just degenerate, just go into this decline of decrepitude afterwards? Say, well, can't lift anymore because I had back surgery, and now the shit just gets worse over time because you're not creating stressful situations for adaptation of the structures around the healed surgical procedure so that it's protected and healthier and you can maintain quality of life and function afterwards. So the problem is most people fall into this other category where they would have had a 16 level rod based spine fusion and just given up pretty much. And all that's going to lead to is more pain, more dysfunction, more depending on other people, reduced quality of life. And this person took the other route, and he may have done it on his own, or he may have had a quality surgeon and rehabilitation team that understood the key to all of this is maintaining the integrity of the structures that are supporting the surgical procedure that was done. If he avoided everything, got deconditioned, detrained, and let himself get weak throughout that area, it's going to cause more problems down the road than if he had maintained some sort of training regimen. Now, get the clearance, work with somebody who understands what you want to get back to and is going to approve of it and monitor it. Work with people that are going to be able to help you work within the framework of any new limitations you may have after the surgery, but don't stop, because the instant that you quit training after something like that, the wheels are coming off and things are never going to get better. They're only going to get worse. And just remember, even big procedures like that, they don't put a lifetime contraindication on training. So with that said, take a look at the rest of my videos. See you next time.